everyone. Thanks for coming. Jay Lee, who is the CEO of SAC Calcium, okay, will be doing the lecture. And I will tell you that I've been in the health business now for 40 years, just over 40 years. And I will tell you, there's never been, there's probably only maybe 2 or 3 real nutritional scientific breakthroughs that I would really go, wow, that's life-changing, life-saving. Well, honestly, this is one of them. And I know you've heard this pitch before, but I'm not giving you a pitch. When you see the science that is based on this product and what this product can do, there is no other product that can do this. Understand something. Every other calcium product on the market is not doing what it's stating. Did you get that? Okay. So it's really funny, how, you know, we're allowed to do things that really don't work in the health business, but when you do things that really do work, you usually get yourself in trouble, right? So everything's kind of upside down and backwards. But I really want you to really listen, and I want you to really challenge him or myself on the information, and you'll find out this is science. This is real. You know, they've actually scientifically done something that they never thought was possible. If you go to PubMed, you'll see thousands of papers that talk about how if somebody could invent, okay, an ionic calcium to just have the ion. And guess what? For over 100 years, they talked about it, but no one could do it. And you'll see all these thousands of papers. And here we're sitting on it right now. And we're sitting on a new threshold, something that is really huge. Okay, so I'd like to invite Jay Lee up, and thank you.
Thank you, Darryl, for a wonderful introduction. How are everyone doing today? Well, the most important nutrient is the one that you are lacking the most. But here on the screen, you'll see one nutrient that is most misunderstood, and that is calcium. You go to a doctor, and one doctor will tell you, well, your bone is emptying out, so you need calcium supplements. But the doctors will tell you, don't take calcium supplements. Just take it from food. And after taking all those calcium supplements, you find out years later that you're not really building your bone. And all the calcium that you're taking is actually piling up elsewhere in soft tissue. And also, more danger is piling up intracellularly. So here we go. Calcium plays many roles in your body, especially in cellular level. Calcium is the signaling agent. That's how your cells communicate. When cells undergo division, it's talking in complex language. Amplitude modulation and frequency modulation. You heard about that's how we listen to radios. That's what's happening. That's how our cells are communicating. This is what calcium does. Muscle and heart contraction. It's not just bone and teeth. It plays an important role in blood clotting, stem cell regulation, neurotransmitter, fertilization, hormone secretion, enzyme activation. List goes on and on, right? This is what calcium actually does. But do you see how here, it doesn't say calcium, it says calcium ion +2. That's the only physiologically active calcium our body uses, right? When calcium enters your system, it has to be in ionic form for your body to utilize it. That's something you don't hear often. But look at this. This is how calcium usually goes into your system, whether you're getting from food or supplements. It has to be digested first. It takes a lot of energy from your body. You need help of vitamin D and peptides and strong stomach acid. And it goes into your system as, guess what? Protein-bound calcium. That's it. It's not going into your body as calcium ion at all. It's bound to protein. It's more like standby calcium. It's in there to provide calcium ion when the conditions are met. But you know what the problem is? As you grow older and older, as your growth hormone goes down and sex hormone goes down and living more sedentary lifestyle, you're not really doing activities that are stressing your bones, then that protein calcium is not going to be utilized. So doctor may see your bone emptying out and say, oh, you're calcium deficient. But you know what that means? That means your body needs calcium ion. It's crying out for calcium ion. And it cannot utilize the protein calcium well enough. So instead, it's actually reaching out to your bones to take that needed calcium ion by breaking down your bones. So it's getting that calcium ion and also phosphorus from your bone. But you know why that calcium is bad calcium? It's actually called bad calcium because you're not only getting needed calcium ion, you're also getting the other product, which is phosphorus. When the concentration of calcium ion comes together with phosphorus, it increases the calcification factor. That's why after age 40, when your bone density starts to go down, you're going to get massive calcification happening. And that is actually the root cause of 147 degenerative diseases. It's calcification. We are dying by calcification. Dr. Thomas Levy wrote a book called Death by Calcium. That's right. That is the root cause because your cells cannot communicate. Your body cannot communicate. And you know what happens when you don't communicate? Everything falls apart, right? So this is the problem. You're getting your calcium in protein form and your body cannot utilize it well enough. So you may have a lot of it, but your body still thinks you are calcium deficient. So observed but inactive. So you're taking all these calcium supplements that goes in as protein calcium. You're getting that big waves of protein calcium your body doesn't know what to do with. And a German study found that if you've been faithfully taking calcium supplements, you have actually increased the risk of heart attack. Not just that, that means your calcification is happening all over your body. It's calcium displacement, not calcium deficiency. That is the problem. You're getting the wrong form of calcium and it's piling up everywhere in your body. A survey of 13 space station astronauts, they're staying in space station for 6 months, and they found out average, they lose about 14% bone mass. Think about it. They're taking probably the best, the food, scientifically prepared food up into space. I'm sure it has plenty of calcium in there. They are taking the calcium into their system, but why are they keep losing bone density? Because there's no gravity up there, your bone is not stressed, and your body cannot utilize protein calcium. So it's still reaching out to your bone to take out that needed calcium ion. And some actually come down with 30% bone loss. You're going up there as 30, 40-year-old and coming down with 80-year-old bone health. Think about that, right? This is calcium dilemma, right? You build your bone up to age 35 and 40. And after that, it's downhill, right? And that means all the calcium coming out from your bone, especially as you get older, your body takes out more calcium from your bone than needed. And all the extra calcium is not going back to your bone, but it is calcifying your body. Now, that's a big problem here, right? Nowadays, even the precious calcium ion that you have, it's all used up because of the processed food, all the junk food they're putting in your system that calcifies your body. It makes your body more acidic, right? And our body uses calcium ion to neutralize acidity of your body. As you grow older, you cannot even get the protein calcium in your system well because your stomach acid is getting weaker and weaker. Lack of exercise, sedentary lifestyle, right? It leaches your body of calcium. Stress and fear, right, causes inflammation in your body ultimately and leaches your body of calcium. So, knowing that only calcium ion is the needed form, physiologically active form of calcium, your body has to maintain good amount of calcium ion in your blood. So 50% of calcium is in ionic form. You have about 45% that is protein-bound calcium, and this is just standby calcium. It's there to provide, but then we have problem utilizing it well enough. So we'd like to show you invention of new calcium. We call this invention of new calcium because it does not exist in nature, but it is not something man-made that's going into your system. What this does is we actually made calcium ion delivery system. So this calcium utilizes very special form of chemical bonding called sigma anti-bonding. Now, this is a very difficult bonding to maintain in room temperature. You're probably not going to find any natural molecule that has sigma antibonding stable, but we managed to keep it stable in room temperature. All that does is it weakens the bonding of calcium so that it can be easily knocked off, right? So the calcium atom can be easily knocked off from the molecule and be absorbed to your system through diffusion and osmotic pressure. So here is how it looks like. Now you see here how the regular calcium carbonate has strong pi bonding. This is all the bonding that you'll find on planet Earth, right? Calcium ion is always bound in pi bonding. Here it has weak form of bonding called SAC, sigma antibonding. Now, sigma antibonding is when the orbitals come together in ways that has a higher energy level, and atoms always want to go into lower, more stable energy level. But then we managed to keep it together, right? So here is the picture of sigma antibonding compared to the strong pi bonding you find in all the calcium in nature. It is 200 times more soluble, and look at the chemical formula. SAC calcium carbonate gives off 2 calcium ions, an oxygen, and 2 carbon dioxide, while regular calcium carbonate gives off just calcium and carbonate. Now, do you see anything here that your body does not know what to do with? Calcium ion, oxygen, carbon dioxide. There's no man-made molecule that's entering your system. You're just providing for the first time in the world that needed calcium ion. It's the only form of calcium that our body uses. Because SAC calcium has the weak bonding, it still has that charge, and it works together with water molecules, and it has a very special physical property. We call it flying calcium. When the water evaporates, it actually flies out together with water. Any other calcium, dissolve it as much as you can, let the water evaporate, and you'll find out that they have a thick residue of calcium in the bottom of the container. Right? This one flies out. Right? So here, it is absorbed in ionic form. You don't need vitamin D anymore. No digestion needed. It goes into your system as calcium ion, not protein-bound calcium, right? And it goes to work right away. This is the form our body can use and recognize. So here is a review how regular calcium, you need D, vitamin D, peptide. It has to be digested, and it goes in as protein calcium. This is how it looks like. This is how you're getting all your calcium. But here, no energy is required, and it goes in as pure calcium ion. It goes to work right away. It's a very unique form of calcium. It lasts about 4 hours. It elevates the concentration of calcium ion slightly up to safe reference level, but it is good enough to turn off certain switches and start cascade of hormonal responses. That's going to bring in tremendous healing properties of your own body. It is actually your body that's healing yourself. We're able to turn on those switches because of calcium ion. When calcium ion concentration is raised, then it's picked up by pituitary gland, and it activates your thyroid gland, and it activates osteoblast, which is our natural bone building process. It actually enough just to switch on, that's it. We're not talking about supplementation. We're talking about actually calcium treatment, because we're giving calcium in ionic form just to turn on certain responses in your body, which we couldn't do before. But when we did it, we saw amazing results. Now, the amount of calcium they're putting in, if you have about 250 milligram of ionic calcium in your body, we're only adding 5 milligram. We're actually adding 0.1 milligram per deciliter. It's not going to cause hypocalcemia, but enough to turn on your body's response. So, as you're growing older, a lot of people fall under category A. Because even though you have protein calcium in your system, your body still thinks you're calcium deficient. So it's taking out calcium from your bones, and that actually gets deposited in the wrong places and causes calcification. And it is actually the major cause, not the only cause, but the major cause of 147 degenerative diseases. Many of these diseases that you know, that you can name, all belong here. Let's say you're in category B, where you're more health conscious, you're taking calcium from your food with magnesium, vitamin D, vitamin K, and you exercise. You may be utilizing more potent calcium, but guess what? Because of the drop of the hormones, your body will still take calcium ion from your bone, right? Not as much, but then you're just delaying this 5, 10, 15 years. Eventually, you're going to get there. Eventually, you're going to experience calcification that's going to break down the cellular communication, and your cells are doing some aberrant stuff, the things that they shouldn't be doing, and even confuses your immune system, right? And it could cause damage to your own body. But then now with AIC calcium, you have the third category. With ionic calcium treatment, you can start thyroid hormone bone building for the first time. And by doing so, you can actually clear all the calcification that happened in your body, even in cellular level, and bring it all back to your bone, right? Even from soft tissue calcifications, right? And it also activates that inactive protein calcium, and you can utilize it all. Imagine astronauts are taking this to the space station now, right? Even if they are not really stressing their bone to utilize the protein calcium, now they can actually activate the protein calcium and use that calcium ion. Dr. Robert Heaney said, of course, all of these diseases may have many causes, but they also all have one thing in common: calcium deficiency, or better, calcium displacement. If you're looking at your bone, right? Oh, our body is taking out calcium ion, so it must be calcium deficient. No, it is not. You're not really utilizing the potent calcium well enough, right? For menopausal women, it's actually worse, right? Because it stimulates parathyroid hormone to take out more calcium from your bones. 3 to 5% bone loss every year. That's scary. So if you look at the bone density graph, you're going to see actually steeper dip for women compared with men. So this is not calcium supplementation, but rather calcium therapy. And we like to, at this point, it's good to give that disclaimer. We have actually found a way to put calcium ion in your system. That's the only, claim that we have. The rest is your body. Rest is your body reacting to calcium ion. So recent research found out that senior women who have low bone density are more likely, even twice likely to develop Alzheimer's disease. And not only Alzheimer's disease, but all these age-related multifactorial progressive degenerative diseases occur in seniors. Okay? So let's look at osteoporosis. We know that now, even in Canada, 49% of infants are born with calcium deficiency. A long-term study done in Denmark with 35,000 people actually showed that if you have strong bone density when you're 50s, then you can actually live 11.6 years longer. Now, how much would you pay if you could live 11.6 years longer? Right? All the calcium that you have taken didn't really help you to build bones. Actually, there was a study done early 2018, in January. I actually heard a news report. They gather all these studies done and really asked this question: taking all the calcium supplementations and with vitamin D and all that, did it really help us reduce the rate of fracture? And the answer was no. And you know what they actually said? They said it was actually waste of money. No, actually, it's worse because you endangered your health more because of calcification. If you look at these osteoporosis drugs, scary. Look at the side effects. Would you really want to take this? This is messing with your bone metabolism, but you are actually compromising bone health. Right? All these drugs, right? It's actually looks like it's retaining calcium in your bone, but think about it. Your body needs to take out calcium ion from your bone because your body desperately needs that calcium ion because of all the other functions that calcium ion is used for. And when your body is trying to reach out to your bone is not releasing calcium ion. So where do you think your body is going to get that needed calcium ion? That's why these do have a lot of side effects. We have actually published, this is the animal study that got published, and we have compared SAC calcium with regular calcium. And the bone building power of SAC calcium was about 100 times stronger. And we also took another research. We took out the ovaries and induced osteoporosis. And then we found out that when that happened, this ovary actinomized rats start to lose bone density rapidly, right, compared to the control group. But with SAC, it went back up to the normal level. This is a human clinical. Within 6 months, this gentleman had bone density nearing osteoporosis, but now back to normal. Changes like this is considered medically impossible. Even one case is considered impossible. Here, 60-year-old female from osteopenia. You can see the steeper curve for women, but here in osteopenia, in about 3 months, back to normal level. This kind of bone growth was never seen before. Here's a 56-year-old female, severe osteoporosis, back to osteopenia level. This is the median. So now at least she's back to the average level, right? If you go to a doctor's office and you find out that this was your bone result, that indicates that you have already severe calcification, and you have already set yourself up for a lot of degenerative diseases. And really, there was no cure for this. There's no way to reverse this. But now with SAC calcium, this is possible. See here, just 3 months, minus 2.6 to minus 0.6. That's about 20%, right? So you're in a normal level now before you're in osteoporosis. You can see here, calcium deposits. This is a calcific tendonitis. Here, completely disappeared, taking SAC calcium. It is not just building your bone, but it's actually utilizing calcium that is stored in the wrong places of your body. See here, this is the enlarged. This, all gone. This one actually, the person has taken a picture probably a year after, right? But look at this. When a tooth is extracted, right, usually with an infected tooth, you'll find that these sockets will not fill up. But here, it filled up without bone graft completely in 10 months. I asked so many dentists, is this possible? They'll say, no, it's impossible, right? But not just filling up your the socket, but then it actually built up your entire skeleton. This is before, and this is after, right? You can see the difference, right? Just focus on one picture and see before and after. This is before, and this is after. This is before, and this is after, right? It's building alveolar bone again. This girl had bone necrosis, hospital recommended amputation, but 1 month later, she saved her foot. Calcium ion plays a very important role in stimulating stem cells. Your body has mesenchymal stem cells. It's there to repair your body, but because you have so much calcification, it disrupts the calcium signaling. Your cells are not as active. But once you actually fine-tune the calcium signaling in your body, now all your stem cells become very active and start to repair your body. Look at this research. Calcium ion-mediated signaling is essential for the maintenance of stem cells and promoting their development and differentiation, right? And only SAC calcium, by restoring calcium homeostasis, now optimize your body's communication. Your stem cells wake up and they go to work right away. Especially in your mouth, you have a human periodontal ligament stem cells, very active. It can be turned on and start repairing, right? You got to have that 2-to-1 calcium ion and phosphorus concentration. You got to have almost exact for your stem cells to be active. Most people don't have it. But with AIC calcium, we can now fine-tune it and turn it back on. And your stem cells can actually donate mitochondria to damaged cells as well. And that is also calcium ion dependent process. So, hey, let's look at arthritis. Now you know that we can build strong bone. What about arthritis? Some doctors call arthritis osteoporosis of your bone, of your joints, right? And because calcium ions can go anywhere in your body, it can go and stimulate chondrocytes, the stem cells in your cartilage, and regrow cartilage. Once thought impossible, but we had arthritis patients with crooked fingers like this, now able to live normal life. Not only that, it actually restores the immune response around your joints, right? So it actually balances, it breaks down all the calcium deposits, it corrects immune response, repairs cartilage, and its alkalizing effect eases the pain. Calcium ion, your body uses calcium ion to maintain your body's ideal pH of 7.4. So here you can see the research is like this. Cartilage formation requires a concerted action of numerous intracellular signal transduction molecules, many of which are sensitive to the changes of intracellular calcium ion concentration. If you have that right, then your stem cells get to work. You can dissolve these mineral deposits. We had patients suffer gout for 19 years, and within days, find out that he could walk and dance. Now let's look at AIC calcium's effect on cancer. We helped so many cancer patients, right? Carcinoma produces lactic acid that makes your body acidic. But did you know that lactic acid is not just a byproduct of cancer cells, but it becomes the food for cancer cells as well as is the invisible cloak. When it reduces the local pH down to 6 to 6.5, your immune system turns off. That's why your immune cells cannot see the tumor cells. But when AIC calcium is introduced, it neutralizes lactic acid, right? It reveals a tumor, right? And your immune cells regain the power. And here, another research shows that a rise of intracellular calcium ion actually supercharges your immune system to go and attack cancer cells. So Dr. Carl Reich, he said, he considered cancer as the ultimate adaptation to ionic calcium deficiency, tailor-made to survive and thrive in an ionic calcium deficient environment. If you open up a healthy cell, let's say you find 100 calcium ions. If you open up a cancer cell, how many do you think you're going to find? Maybe one. I think that answers it. Right? But not all cancer is acidic. Some cancer, like sarcoma, is alkaline. But calcium ion can also neutralize ammonia to bring it down to normal pH. Because of it, it can also help cancer anorexia patient. But this is actually really what the highlight of what AIC calcium can do for cancer patients. There has been a lot of study done. You know how chemotherapy attacks cancer from outside, radiation from outside, immunotherapy is from outside. But why not turn the switch back on that we already have in our cells, that's turned off for most cancer cells, and that is p53 gene. Now, this gene is responsible for self-destruction, apoptosis. In a healthy cell, p53 gene will check and to see if there's anything wrong. If you find something that's repairable, it initiates repair. But if there's something beyond repair, then it undergoes apoptosis. Let the diseased cell die off and be replaced by a healthy cell, right? And we found out that most human cancer cells have this p53 gene turned off. And that's why, even though a lot of things are wrong, these cells are multiplying and proliferating. Researchers found out that in order to turn this p53 gene, you'll actually find this a lot if you do research. They found out, whoa, it's actually calcium ion. right? So switching p53 state by calcium, right? And here, found out that cancer cells make a lot of NF-kappa B protein that interferes the work of p53, but calcium ion can really break the dance between the two and let p53 do its job. And also, calcium ion can trigger the production of nitric oxide, which also activates p53. Right? Another research shows that when calcium ion is added, then it inhibits this process that makes p53 from less active to more active. You know what? All these studies are already done, right? It's confirming one another. They knew it. They know what can turn the p53 gene back on. Only problem, we didn't know how to do it in vivo. How do we put calcium ion directly in our system? There was no way. All the calcium you put in goes in as protein calcium. And we have a problem even utilizing it for our bodily use. How can we put enough to even do something like this? That was the problem. But now we found the way to do it. Look at this research. Experimental works of the past decade have highlighted the importance of calcium ion in the regulation of apoptosis. Right? You're going to find this is actually the most studied gene in the history of cancer research. We knew the answer, but we just didn't know how to do it, but we found the way to do it in vivo right now. Sensitivity to apoptosis depends on the ability of cells to transfer calcium ion from ER to the mitochondria. And also, calcium ion is a great COX-2 enzyme inhibitor. COX-2 enzyme, what is it? It is actually the enzyme that really spreads your cancer, right? It fuels cancer growth. And you will find this enzyme multiplied 100 times and 60 times for certain cancers, right? Without inhibiting this, then after you're having surgery or something, then you're going to have cancer just multiply, right? SHC calcium can help inhibit COX-2 enzyme. Now, this is a very important concept, right? Now, according to mitochondrial free radical theory, now this is very important because you know what? As the cellular calcification happens, now this happens to everybody. These calcium ions do get deposited in the walls of your own mitochondria. Now, when that happens, your mitochondrial function does not work. It dysfunctions. So it's not producing enough energy, right? As more calcification you have, the less energy you have. Your body temperature goes down. This happens with aging, right? That's because you have a large accumulation of calcium ion in the walls of mitochondria. And guess what? When this happens, it produces a lot of reactive oxygen species, a lot of free radicals. Your body, your own cells, become the factory of free radicals. Well, you may take those plant-based antioxidants, right? Some are good than others, better than others, but it's not nearly sufficient enough to neutralize all these free radicals made by your own cells. So guess what's going to happen within your cells? It's damaging DNA and RNA and proteins and lipids, and it's causing mutations. This is the major cause of aging and even cancer, right? This happens with time. There was no way to reverse this. Decalcification in cellular level was something that we had to live with, but now became possible. You've seen how much we're able to build the bone density within a short period of time. That happens because your body is actually, even cellular level, giving up all that excess calcium, restoring the function of mitochondria. So you get more energy. Right? Actually, the study was done by Dr. David Sinclair. When he actually improved the communication of DNA and mitochondria, he could not tell the difference between 6-month-old mouse with 2-year-old mouse. 2-year-old mouse age is very old. This is a test we have done. This was actually in vitro. We took the heart muscle and let it cool, and that's why it's all blue. When we introduced calcium ion, guess what happens? 10 seconds, 20 seconds, 40 seconds, all that cells are firing again. Mitochondria is firing, producing energy and heat. We have done an animal test. This is done by Charles River Company in Canada. And we transferred the colorectal cancer. And this group, right, after the third week, 70% of the tumor stopped growing and decreased in size. And we also given this to the athletic team to see if this really reduces lactic acid. Yes, it did. And then it also improved their swimming record as well. So let's look at some clinical cases. 80-year-old female, she came to us with last stage multiple myeloma, did chemotherapy. Her kidney was destroyed down to 10%. She really had no hope to live, right? So she took AIC calcium for about 1 year, and you'll see that towards the end of 1 year that her blood work looks almost normal, right? So here's the graph. She's still healthy, right? Look at her bone density score. From minus 3.6, severe osteoporosis, back to 0.9, normal. Now this is 80-year-old woman. How would you like to have a bone of your 20s or even 30s? Right? Now you already sense that this is actually groundbreaking discovery, right? Yeah. Look at her damaged kidney number from GFR 10 to 60. Right? She was actually preparing for dialysis, but she didn't have to. 51-year-old male, adenoid cancer, had 3.5 centimeter tumor with all the smaller tumors. The larger one was largely removed, but then he actually declined radiation therapy because of the fear of side effect, because it was right on his head. But then after taking AIC calcium for about 3 months, all the traces of remaining cancer disappeared. His results. Here's a 35-year-old with cervical cancer. Prior to this, she did chemo, radiation, and surgery. Nothing worked. And after taking AIC calcium for 1 month, right, the tumor is going down in size. And then in August, she finds that white blood cell count is back to normal. And then August 18th, look at the tumor size, really small. And then next month, she's declared cancer-free. Her paper. You can see lymphoma, see how with time, she took about 1 year, and look at it, lymphoma even drains itself. She also had a dementia and schizophrenia, all her symptoms are gone. Yes. Yeah. I'll show you later, it's coming. Okay, this is a leukemia case. Within 1 month, you can see the blood result coming back to normal. Another leukemia patient in 1 month coming back to normal. 81-year-old colorectal cancer with liver metastasis, stage 4, about 3 months, everything looks normal. And the doctor called me, my patient couldn't even sit on the chair, but now he's just active and running around. And the scan shows the tumors are gone, but why is the cancer marker high? That's because when the rapid apoptosis happens, your body's trying to get rid of all the remainder of cancer, right? So you may find some traces of the cancer in your blood. So you may see the skyrocketing cancer marker and going down. So we tell doctors, don't get scared, right? This may happen. Even sometimes tumor looks bigger, but it's actually inside, it's all empty, right? Because it's dying off rapidly. We had cases where breast cancer, it doesn't matter, I mean, all kinds of cancers, right? We had really good results. Right? I mean, this is not a magic bullet, but most of the patients that we treated with AIC calcium had really positive results. Even pancreatic cancer recovering fully, right? So let's look at, because of time that's remaining, let's look at its actual effects on neurodegenerative diseases, right? Before, we saw that, Alzheimer's patients have this amyloid and tau protein piling up. How do we prevent it? But they did further research. And guess what? With all the researchers, now they're coming to one consensus, and that is, you know what? All these diseases are happening because of the disturbance of calcium homeostasis in your brain cells. So now the future treatment focuses on how can we balance calcium in our brain, right? All happens because of disruption of calcium homeostasis, and your neurons and all the glial cells are doing the wrong things. It's cutting off amyloid protein in the wrong place and creates amyloid beta our body does not know how to get rid of, right? That's why you have Alzheimer's, right? Look at this. This is research. Collectively, the available data show that perturbed cellular calcium homeostasis plays a prominent role in the pathogenesis of Alzheimer's disease. Another research, look at this. Because of these calcium ion signaling abnormalities, it tilts the balance and it weakens the synapses and eliminated in Alzheimer's disease, right? Insufficient intracellular calcium ion content leads to abnormal functioning of neurons, and then excessive calcium levels will kill our neurons. These researches goes on and on. You'll find plenty right now, right? Look at this, for Parkinson's disease, right? Because calcium ion signaling affects all aspects of neuronal cell biology, cells must tightly regulate calcium ion level to avoid uncontrolled response that could otherwise lead to pathological condition and cell death. Parkinson's disease as well. Look at this. This is for ALS. Altered calcium homeostasis and calcium signaling pathway activation is one potential mechanism that accounts for at least 3 major and interrelated toxic pathways. That is oxidative stress, mitochondrial dysfunction, and neuroinflammation. Whether it's ALS, whether it's MS, I can go on and on and on. These researches are there. 85-year-old with Alzheimer's disease. We have so many Alzheimer's patients in the onset of the disease, just stop the progression, and then the minor symptoms reverse back. We had dementia patients. This is actually one of the testimony of a doctor about his mother. Dementia for 3 years, could not remember anybody, now remembers everybody. Now her personality came back. She's telling all the nurses, I like this, I don't like this, you know that I don't like this, and now causing more problems, right? But everyone's happy. Have you ever heard anything like this before?
Hey, can I say that?
Yeah.
I have a gentleman, this just happened, okay? So he's got ALS, okay, Lou Gehrig's disease. We all know it's incurable, right? So they didn't want to, but his family and his wife had to send him to their nursing home because that's the only place. You know, you can't wash and pick up a 200-pound person because you lose all motor control, right? So anyways, I know it might be a little bit hard to believe. We did a couple other things, but the main thing we did was we did the SAC calcium. Now, whether you want to believe this or not, he couldn't move his legs, arms, and he couldn't lift up his head, and he couldn't talk properly. You'll see that testimonial on my website. We just did it 2 weeks ago. He's now coming home. He can move his arms, he can move his legs, he can lift his head up, he can talk properly again. All right? So understand that. All right? So incurable is just a word used for somebody who didn't have the answer yet. Okay? All right? And when we have time, if we leave a couple minutes, I have somebody that would like to give a testimonial if we can near the end, okay?
Yeah, definitely. I mean, I could just go on and on with ALS cases and Parkinson's cases and all these things are happening, right? Parkinson's is 75-year-old, just all the symptoms disappear. Once considered impossible, now happening. And you have to know that when calcification happens at cellular level, it causes inflammation. Inflammation brings more calcium in, right? And guess what? When your cells are not communicating properly and doing all these aberrant things, then everything breaks down. And all these, it doesn't matter. I mean, what this hits first is a symptom that you're going to experience. It could be cancer, it could be Alzheimer's or Parkinson's. All these things can come. Metabolic syndrome is also a calcium-dependent process. Diabetes, look at this. This is ADA, American Diabetes Association site. In recent decades, insulin resistance and secretion have been shown to depend on calcium homeostasis. That's why a lot of patients that were taking SEC calcium for different purposes, they all found that their morning sugar level all dropped to normal level. They're getting off their medication, right? These are the researches that shows how says oral calcium ion supplementation improves insulin sensitivity, right? Tons of researchers out there. Now they're all coming and realized that, you know what? This is actually the problem of calcium, disruption of calcium homeostasis, right? My sugar level dropped 120 points. My sugar level dropped 50 points. All these things are happening, right? Cardiovascular disease, people with couldn't even operate it on. Because of calcification, these cells are not firing properly, the muscles not contracting properly. You get all kinds of heart issues with palpitation, right? They all, we have helped so many patients recover, not taking medications anymore, right? People who received a death sentence by their cardiologists are now living normal and healthy life, right? Goes on and on. Well, we had patients when treated with AIC calcium in the early stage, right after the stroke, could not use half of the body, able to move again, right? But then I think because of time, I think it's a good time to bring in some testimony, right? And then we're going to go into Q&A.
And if I can say something, if you get that person on SAC calcium, and then you get them on a water fast, and then a couple other supporting products, it's going to refire again. Let's turn on the body's ability to go in and eat up the scar tissue that's actually causing the displaced energy not to move around in the body and actually signal. So, you know what? If you just support the calcium by doing a water fast, you can't do a juice fast, you have to do a water fast. It has to be a water fast. It's the only way to create the stem cells, the only way to create the autophagy to go in there to eat up the scar tissue or any of the cells that have caused necroses, whether it's in the brain or anywhere else in the body. Why don't you come up and tell your story about the calcium? This is Hope, everyone. She has two little stories to tell, okay?
Hi, my name's Hope, and I started taking the Merigen in November. And when I was 5 years old, I got hurt in an accident, and I had a cut on my chest about 4 inches long. And it's been growing since I was 5 years old. I'm now 48, so you're talking 45 years of scar tissue growing, calcification, crystallization, growing, getting harder and stronger. Started taking the calcium, took it 4 times a day, and it is disappearing. Pretty much it's gone, to my surprise, but I was so grateful. And I did a couple other things. Obviously, I did the diet and
Some deep tissue.
some deep tissue. I had 3 sessions of wolf deep tissue, 3. And the first time it was rock solid. Next time, it just was slowly going away, but it was going away a lot quicker. This time, I just had it done 2 days ago, and it just melted apart completely.
Pull the calcium out of the tissue and London Bridge falls down.
Yeah.
And when you pull the calcium out, that's the cement that glues all that and causes that hardness. Whether you're talking about her scar or whether you're talking about a tumor or a fibroid or a stiff joint, anything. Okay, why do we say, let's cement it together? Pull the cement out, put it back into the bones, and get it out of the tissues. What else did you find?
And I noticed that I had a couple loose teeth, and I was checking it out the other day. Solid, not loose anymore. And I feel a lot better. When I first started on it, I had more energy, my body. You can feel it, which is pretty amazing. I loved it, and I'm so grateful for it.
So everybody, later today at 6 o'clock, we're going to be going through this whole calcification, scar tissue formation. We're going to be actually working on people in that training from 6 to 9 to show you that we can pull the calcium apart. But even if I pull the calcium apart, we still are going to use this to use it as a magnet to pull it all back into your bones to give you that new skeleton that reverse your aging. That's how you reverse. How do you reverse the aging process? Get the calcium back where it belongs, right? And just so you know that we also, all of our products until Tuesday at midnight will be on for 15%. And that means 15% off even the calcium, okay? And also I'm going to be doing a complete slideshow on DocofDetoxShow.com with Jay. I think it's on the 15th or 17th of next week or something. All right, Jay, you want to take over?
Well, I guess we can open this floor up for Q&A. Yes, go ahead.
Question. I'm involved in sports, so the hot topic is CTE,
Okay.
right? So with concussions and dangerous, as in any of the neurotic immune tested for concussions.
Well, for the injuries that involved calcification, we have seen tremendous recovery, right? But then also SAC calcium is used to stimulate stem cells to really our body's own stem cells to go and repair. And we have seen these patients with severe injuries recovering over the time beyond what they really expected. So,
And also, if I can say this, a concussion, what is there right away? There's inflammation and swelling, okay? All right, so we know that where there's inflammation and swelling and it is traumatic, what has to go there? Calcium. So then guess what? Calcium ends up being the block. You know what? When we can go in and we can actually work on someone and do the deep tissue, give me somebody that's had a concussion, and I'll go in there and do the deep tissue and I'll make a change that fast. But how fast would I make it if I could actually get the calcium to unravel itself from the tissues or even from the neurons in the brain? And that's what's happening right now with a lady who was losing her memory. She got her memory back, and then guess what? Then it started to fade away just last week, and her husband was freaking out. And I said, look, it's only going to do that for a little bit, because what we did was we got rid of the inflammation and we caused stimulation to her brain now. But now the calcium's coming off the brain, so she was getting foggy and a little bit dizzy. And guess what? I was right. It only took 2 weeks. It was completely gone because it was just doing the last of the decalcifying of the neurons. Yes? It doesn't. That you can throw that out the door. Yeah, because that's not the deal. Do you know why? Do you know why we are depleted in magnesium more than we are in any other mineral? Because the calcium's all left your bones and it's in your tissues. And because you are a 911 emergency and you don't know it, you're running around anxious, anxiety, trauma, doubt, fear, worry. And that's creating the acidity that's burning up the magnesium, that's pulling the calcium. So let's put the calcium back and let's calm down.
Give a testimony of the cancer patient.
Oh, yes. Okay. So another patient, here's one for you. And I talked about it at the last lecture, but I'll repeat myself. But I've got lots of them. But I only want to talk about the ones that have happened in the last week or two. Understand, I'm never going to talk about something that happened a long time ago, like dragging around like toilet paper on my shoe, because this happens with this product and this protocol all the time. Here's another lady. Her family went and put her into hospice. She had 3 weeks to live. That's what the doctor said. First, she's got breast cancer, went to her lungs. Okay? So she got 3 weeks to live, put her on the SAC calcium, and we have a testimonial by her too. And guess what? Took her 3 weeks to get out of hospice. 3 weeks, she was out of hospice. Guess where she came to me 2 days before I came to Toronto? She came over with her grandchild. She just came from the mall shopping. She's supposed to be dead. Dead woman shopping. That was on the news just the other day. No, I'm kidding.
Yeah.
What is this different types? What is the special about this one?
Different potency. We do have maintenance products. We have products for kids. But we also have the strongest product, which is Maragen. We definitely recommend patients to go strong and reverse the condition and go on the maintenance dosage with products that are good for cartilage formation, for your joint issues, for the dental, right? All so that you don't have to pay more than needed. But then we recommend if you can just go with the strongest product, it's a little more money, but then that means you can turn the disease around much faster, all right? I just like to say that SAC calcium is the calcium that resolves all the calcium problems. Calcium was the most difficult nutrition, right? It's most difficult, we didn't know how to handle, right? It causes more problem than it helped.
Well, we
But now-
didn't want to talk about it.
Yeah.
As health practitioners, we didn't want to talk about the subject. Why? Because we didn't want to look dumb because we had no answers. right? So now I'm looking pretty smart.
Well, thank you for your attention. All right, I think our time's up.
Thank you.